So if we start to look at the abdominal area, thoracic area, here again, some of these I will have you label. The thoracic aorta is when it descends and it's in your chest region. So it actually comes down behind your heart. So it's going to sit behind your heart in the thoracic region. Internal thoracic artery, intercostal arteries, probably won't have you label those. Abdominal aorta then, so my descending aorta goes through my thoracic area, gets into the abdominal area. It is now called the abdominal aorta. Supplies your abdominal wall, so it's going to go to your external iliac. Lumbar is going to be in arteries that break off in your lumbar region towards the bottom of your back. This page is probably another good page. So common iliac arteries are going to branch off into your legs, and they are going to supply pelvic area, your glutes, your lower extremities, your legs. Common iliac arteries divide into, here again you're going to have an internal iliac artery and an external iliac. Femoral, it's then going to branch into the femoral, which is going to run along your femur, so that's where the name comes from. Popliteal deals with knee region, anterior tibia, posterior tibia. So the names, if you remember your skeletal system at all, you should remember these. So as far as labeling, you should know definitely your common iliac. Common iliac is going to branch off. It's going to then form external and internal iliac. And then my femoral vein, or my femoral artery, sorry, is going to run down pretty much the length of my leg. Tibial, tibial is by your tibia, but quite honestly, I don't think I have that one on there. I'm sure I'll have renal, ulnar, radial. I don't know about celiac. Mesenteric arteries are going to lead to the front mesentery of your abdomen area. Brachial, you should know, brachiocephalic, your carotids are up there again. Those I already told you about. So mostly I will be quizzing or having you label the larger veins. So once we've done arteries, you're going to know most of your veins because a lot of them coincide with each other. There are a few that don't. So veins bring blood back to the heart. Like I said, on diagrams, they're most often blue, other than pulmonary. Larger veins parallel the courses of arteries, so they run right side by side. And that's why a lot of them are named the same, which also makes it easier for you to memorize them, so that's a good thing. Veins from the head and upper torso are going to drop into your superior vena cava, which we already looked at on the heart. Veins from the bottom come into the inferior vena cava, which we already looked at. And then they are going to drop into your right atrium. So your vena cavas, you're definitely responsible for knowing. Jugular veins are large veins that are going to drain the head, so that you should be aware of. Unite with subclavian veins, brachiocephalic veins. So if I told you that you should know your brachiocephalic artery, you should know your brachiocephalic vein. And they drain, they're coming from the head and arms, so they're going to drain into the superior vena cava. So the only thing that's really different here is the main veins are your jugular veins. They're not called carotid. But then I am going to have, here's my right subclavian vein. Right next to it in red would be my right subclavian artery. Let's see. Basilic, cephalic are major superficial veins. Probably won't have you label those. Here, number 3 would be the big one on this sheet. Radial ulnar veins, brachial vein in the arm, axillary in the armpit. And like I said, once you know one, it's very easy to learn the other. So if I compared both, here's my, this picture is pretty much like the picture that you looked at in red. Just instead of saying subclavian artery, it says subclavian vein. Here I still have axillary, which is in my armpit region. Brachial is going to go down my arm. Radial vein is going to be on my thumb side. Ulnar is going to be on my ulna side. So they're pretty much the same. Here's one that's different. Tributaries of the brachiocephalic. Azygos is a specific vein. There's not an artery that coincides with this. So azygos vein drains the abdominal area and also your thoracic and chest area. Another one, hepatic portal system. Hepatic deals with liver, so it's going to drain your liver. The liver is very important. We'll talk about that more in the digestive system, but it absorbs nutrients, it gets rid of bacteria, things like that. So hepatic veins drain the liver. That's the most important one there. Splenic vein leaves the spleen, also the pancreas. That's a possibility. I might put that one on there. Splenic is possible. So here I'm looking at my abdominal area. What I would like to see, and I don't know for sure where it would be labeled, but this here then is my inferior vena cava. Yep, it's labeled. Here we go. Inferior vena cava is going to run straight up into the bottom of your right atrium. Here I have my common iliac vein. It's going to go into my external iliac vein, internal iliac vein, very similar to your arteries. So here there's one I want to point out. Popliteal knee region, femoral leg, this is the same as your arteries. Here, the great saphenous vein. You don't have a great saphenous artery. The great saphenous vein, I want you to know, a lot of times if they do some blood vessel work, a lot of times they will use this great saphenous vein for moving. They will take out part of this vein and maybe use it for a vessel if they do heart surgery, things like that. Anything else? Rest pretty much correlates with your arteries, so I'm all right there. So here's the vein diagram. Here again, I'm not going to relabel everything other than the great saphenous vein is right here. So if I find my femoral vein, the saphenous vein is more superficial, so it's closer to your skin, which makes it easy to access for surgery reasons. And if I'm looking at it in a diagram, it is more towards the medial side of your leg. So it's towards the inside of your leg. And I'm going to stop with notes there, but I'm going to show you one more thing quick. Going back to the cadaver dissection tool, in order to study for your test, if I go here, I am not logged in. And we've been here before. We went here for muscles. So here again, I'm at the top. There's a select module part. I want to go to So this little dissection tool is where I will click, and then I can pick, so maybe I want to look at shoulder and arm because there's quite a few vessels there that I've talked about. Select view, most of mine will be on the front, so anterior. So brachial artery. I've told you you should be aware of the brachial artery. So if I click there, it will show you what it looks like. So it'll have the diagram up here. It'll have what it looks like in an actual human being. You can actually see that area. And then I could do brachial vein. Notice it's right next to it. The only difference is it's blue. Subclavian, I said you were responsible for, so there you can see it's going to branch off right here. Your diagrams on your test will be similar to this. They'll look like the cadaver, and then the blood vessel will be highlighted. So this is a good practice tool. You know the arteries and veins that I've told you to study. This would be a good way to practice them before your test. And that is a wrap for this chapter.